The most effective non-pharmacological treatment for patients diagnosed with multiple sclerosis includes physiotherapy, symptomatic therapy, and psychotherapy. Regular physiotherapy allows patients to maintain independence for longer. The positive effects of the physiotherapy are possible due to the neuroplasticity of the brain. Neuroimaging and electrophysiological examination shows spontaneous and physiotherapy-induced change in the nervous system. The key of the effectiveness of the therapy lies in its all-encompassing character, that is, the cooperation between doctor, physiotherapist, psychologist, nurse, and social worker. The rehabilitation should focus on restoring the functions lost by the patient or properly controlling the compensation process in order to use the patient's adaptive abilities in the most effective way. When preparing a rehabilitation and physiotherapy program, attention should be paid to the patient's mental state as well as to their level of motivation of exercise on a regular basis. The aim of physiotherapy, in addition to the physical aspects, is to improve the patient's mental condition. In order for the patient to get involved in the classes, his motivation is needed. It is important to present medical evidence that it's worth exercising. Talk to the patient a lot. Translate. Present an idea for exercise therapy. In my opinion, it is a good idea to encourage the patient to try new physical activities or to return to doing what the patient used to like. The activity can be adapted to the condition and capabilities of the patient. Therapy derived from a specific type of sport has a positive effect on the level of motivation to undertake the effort as well as the patient's well-being and self-esteem. This approach allows patients to feel that their goal is not limited to preventing the effects of the disease, the dysfunction they present, but it is an opportunity to learn new skills, develop new interests, or mention to previous ones. Can judo training be part of the rehabilitation of people suffering from multiple sclerosis? In my opinion, yes. I did authorial programs in 2018. An experiment was conducted in which a program of physiotherapy for patients with relapsing-remitting multiple sclerosis was developed on the basis of judo elements. The study involved 4 women aged from 32 to 49 years who had been suffering from multiple sclerosis for several years. Before being qualified into the study, their physical activity was worked. Prior to the beginning of the study, the patient did not undergo any supervised physiotherapy. In the functional assessment, they presented different levels. However, all of them were able to move independently. They reported the following problems related to disease: urinary incontinence, chronic fatigue, balance disorders, and sensory disturbance. In addition, 3 respondents reported a sense of social isolation despite being active professionally. No one of the women had practiced a sport like judo before. What I teach there? Generally, I teach their learning to fall safely, strengthening the trunk muscles, improvement of motor coordination, improved balance, In my opinion, the most important was learning to fall safely. I had good results of this program. The most important of these results are learning a valuable skill, safe falling, reduce the feeling of fear of moving independently, and also after therapy, increase the sense of self-confidence of the respondents, desire to participate more in social life. All of them had a really good fun. They really liked this rehabilitation because they didn't say about this activity how rehabilitation, but some like a sport, like some discipline. They are really like this, and also they feel that this is something new. They can also learn something new, learn new movement. References to use can be found in the literature on conventional forms of physiotherapy. For example, kickboxing combined with fitness and tai chi. In recent years, attempts have been made to specify the impact of individual physiotherapeutic methods on improving on dealing the development of multiple sclerosis. The polemic concerns, among others, the intensity of therapy and the size of the applied loads. It's really interesting that the conclusions of some studies show that people with multiple sclerosis tolerate longer training units of greater and faster increasing in intensity, which allows them to achieve more noticeable progress in a shorter time. In my opinion, it's very important that endurance-based physical activity, in particular short and strenuous series of exercises, significantly increase cardiorespiratory fitness and leads to an increase in the secretion of brain-derived neurotrophic factor and nerve growth factor in people with multiple sclerosis. The good effects of therapy encourage a try and a larger population. This is the most important conclusion in my opinion. Movements in judo training performed in closed kinematic chains and open, they lead to improvement of cognitive function. Practicing judo by people with multiple sclerosis affects improvement of all motor skills. Obtained result allowed to conclude the motor rehabilitation with an innovative program based on elements of judo, causes acquiring new skills, undertaking more complex movements and activities that the patient had previously avoided, and this reduced the risk of mechanical injury as a result of a fire. This is the really big problem with people with multiple sclerosis. Patients setting a goal learning new skills affect increasing self-condition, and they have more open interpersonal contacts and has a positive effect on his mood. Thank you for your attention. This is my first international presentation. I'm a little distressed, but one more motto after this presentation is thinking about what's important now, what we can do now, and how we can people with multiple sclerosis, with chronic disease. They should do what they love what they do, and we should remember their illness is not life. It's a part of life, but life is life. Life is our life. We have control about this. Thank you very much for your attention.